Hello and welcome to another review on health apps. My name's Dr Tom Mickelwright. I'm a UK-based GP with a special interest in digital health. And this review has been funded and brought to you by ORCHA, the Organisation for the Review of Care and Health Apps. Today, we'll be taking a look at apps that can help people manage their diabetes better at home. In particular, we'll be taking a look at Intellin, the Diabetes Forum and Liva health coaches. Now I should say, apart from giving me login codes and licenses to access their apps, I haven't received any financial compensation from any of these three companies, so these are independent reviews. Let's start with Intellin. Intellin is the Fitbit of diabetes apps. It is an incredibly comprehensive tracking tool for monitoring a huge range of different variables that matter to diabetics. Things like blood sugar, the last time you gave yourself insulin, blood pressure, height, weight, physical activities, a whole host of different things that it tracks. Some of those things like serum triglyceride level or systolic blood pressure are probably going to need you to sit down with a GP who can interpret that and draw that information out for you. But by and large, this can be completely patient-led. Once you've recorded all of your information there, you can go into the reports side of the app where you can see your trends over a week, a month, a year. And then the most valuable bit is you can go to the priorities section of the app. Now what the priorities section does is it draws all the information from the tracking that you've done to highlight your highest risk areas as a diabetic. Is it your foot care that's a risk? Your cardiovascular health? Perhaps your eyes? Taking all that into account, it flags the high risk areas, explains that risk, and then offers tailored advice to the patient. After that, patients can go to the tips section of the app, where they will find a huge library of information categorized by area of the body affected. Now, all of this information is referenced, there's an awful lot of it there, and I must be honest, at times it felt a little bit cluttered. There wasn't a great deal of structure to the information there, and sometimes the tips didn't go as deep as I would have liked them to. For instance, one of the tips was to start counting your carbs, but there wasn't any information on how you'd start doing this. There is also a clinician's dashboard, which allows doctors to see all of their diabetic patients at once and to deep dive into individual patients' results in order to see what their diabetic management is like. The overview it gives you is far clearer than anything we've got at the moment in general practice. But at the moment, the app doesn't sync in or integrate with current NHS patient records, which means you can't pull blood results from EMIS and you can't send reports back into System 1 or Vision. That could be a barrier for some people. The app and dashboard are going live soon in a CCG in the Northwest, I'm told, and this company is quite involved in clinical trials, and there's currently a trial ongoing looking to see whether the app changes the way patients interact with self-referral diabetic foot services. So I think there's a lot of potential here. In summary though, this is a great tracking tool for your diabetics. I think in the months to come, as they hone that tips section, we're going to get some really detailed, personalised information targeted to what that patient's needs are, and the dashboard is a very clear way to see how your diabetics are managing over time. The next one we're going to take a look at then is the Diabetes Forum. This is a free app that does exactly what it says on the tin. It's a forum for diabetic patients. What I was most impressed with this app was the amount of engagement from its community. There are 320,000 users of the app at the moment and over 2 million posts on the forum. In fact, the forum advertises that if you post a question on there, the average response time is 4 minutes, which is pretty incredible. I think this is a great resource for new diabetics. As a GP, 10 minutes is barely enough to explain what diabetes is, to break the diagnosis, and to start talking about treatment, let alone trying to give the patient some understanding of what it's like to live with diabetes. And that's where forums like this help. They give a lived experience of diabetes. There were discussions on there about low-carb diets, ketogenic diets, diabetes during Ramadan or fasting, and what it's like to live with an insulin pump, topics which many GPs just won't know much about. If you're wondering how patients can begin to navigate over 2 million different posts on the forum, the answer is the moderators. Moderators are able to flag useful advice, or will sometimes summarize the discussion in the forum, pull it together into a single article and flag that. so it does make it easier for new users to navigate. The moderators are also responsible for enforcing the rules of the forum, the two most important ones being don't cross-post from the Type 1 forum to the Type 2 forum, and don't give advice about changing medication. The only drawback to the app, though, is the obvious. The users and the moderators are not healthcare professionals. In fact, I couldn't really find much information on who the moderators were at all, in terms of whether they were paid, whether they were trained, did they work shifts, did they have conflicts of interest. It's the same for any forum, and I wouldn't say don't use it for that reason. In fact, I think I'll start recommending it for my own patients. But I think it's important to stress how it's used, to emphasize that there aren't healthcare professionals moderating it, and to suggest that if the patient is thinking about any changes to the medication or radical changes to diet or lifestyle, just to check in with their GP first. The last app we'll take a look at then is Liva, which is a health coaching app. Now, the way Liva works is that as a GP practice or a CCG, I'd purchase a number of invitation codes and I would send one of these codes to a patient. That code would allow the patient to register for an account and to book their first 1 hour introductory video call with a health coach. And that health coach will remain with them through the entirety of their journey with Liva. In that hour meeting, the coach will help the patient to decide on their health goals. We'll also start plotting some of the initial metrics like blood pressure, BMI, activity levels, and explain how the app works. From that point on, the patient tracks a number of different metrics. Like I said, height, weight, BP, blood sugar. It can also track mood, activity, and for a premium price it can also sync in with wearable devices to pull that data through too. But the emphasis is less on the tracking and much more on the behaviour change and relationship. The patient will get instant messaging from their health coach. They'll be sent a weekly video summary of all of their progress. They might be invited into groups with other patients for group education. They may be sent articles or tips by their health coach. And of course, there is also the ever-present countdown timer, which reminds the patient how long until the next coaching session and that they better not fall behind. Liva is available as an all-in-one solution that provides its own health coaches, or as a software-only solution if you wanted to staff it yourself. If that's the case, you'd be interested to know that there is a dashboard that the coaches use where they can see all of their clients. They can track all of those individual metrics for those clients, and they can also measure their engagement level. So they can recognize when engagement is dipping and help support those clients a little bit more. Overall, I love the emphasis of this app on behaviour and relationship. One of the common criticisms of digital health is that it underplays the importance of human interaction in health. And for me, this brings that right to the fore. It's a bit of a shame that the basic version of the app doesn't allow integration with wearables, because I think manually entering some of that data in could erode your engagement over time. And I think there is still room for this app to integrate with the health record. At the moment, for me as a GP, if a patient was struggling with smoking or weight loss, I wouldn't necessarily know about it, even though it's something I could help with. So if there's the option in the future to better integrate so we can get that wraparound care for patients, I think all the better. On the whole though, this is a powerful tool for behaviour change, whether it's for your diabetics, those with cardiovascular disease, or just someone else where you want a robust lifestyle intervention to improve their health going forward. That's everything for now. Just a quick reminder then, the apps that we covered today were Intellin, the Diabetes Forum, and Liva Health Coaching. If you find these videos useful, please do subscribe or follow us on LinkedIn or Twitter. My handle is @Mickle_doc or @ORCHA Health. We'd both love to hear from you, find out how you're getting on with these videos and what you'd like to learn about next. Until next time though, take care and stay safe.